I'm an MD since 1984. So, more than 40 years, no? But I became a surgeon in 1990, all right, after my training of being a surgical residency program. And meaning, I'm a surgeon in the last, 30 years or plus, no? 34 years. Okay, I've been doing that. Initially, we do a lot of anything. Remember, the training then was general surgery. But so we handle cancer and non-cancer patients. At that time, there was no specific, like you want to become a breast surgeon, there is a breast fellowship. Wala, no? So if you want to become head and neck surgeon, there was a training for that. No, there is no fellowship then. Okay. But throughout your practice later on, you start choosing where do you think you have a niche, right? So I'm more for breast cancer. It's something personal, no? Because my wife was diagnosed to have breast cancer in 1989. I was the one who diagnosed, and I was the one also operated on her. So from then on, I zero in my knowledge more on breast cancer. When my wife get breast cancer in 1999, I tell you the truth. I was the one who did the biopsy here in MakatiMed. And I was the one who finally also operated on her, no? I cried for 1 hour inside the bathroom. I don't want her to know, di ba? And I said, and my youngest is 2 years old then. And I was questioning God. You give me a good family, and my youngest is 2 years old, and she needs her mother. Okay, I am not, I don't want to raise my family alone. Until now, my wife is a pediatrician, practicing here in MakatiMed, no, by the name of Maria Lourdes, still kicking around and still shouting at me. And you see what happened? Only God who can decide. As you go more mature in your practice, you realize it. Cancer diagnosis is not a death sentence. When you have to break the news about after biopsy, you have a cancer. So what will be the common reaction? The patient was surprised. The patient cried, including male patient. It's not, we thought, only female. No, including male. Why? Because they thought, that's it. That's the end of it, right? No, because throughout the years, we observed that is not correct. Okay. Why? Number one, cancer behaves differently from one patient to another. Secondly, cancer also has types. Some are aggressive, some are not aggressive. Okay. Number three, there are so many new strategies in treating patients nowadays. You compare the treating patient now versus 30 years ago, it's different. Okay, but the connotation having a cancer for a patient, that's it. That's the end of it. No. And this is the most important. I've been telling my patient always, number one, nobody can tell you how long you're going to live. Okay, you should understand that. Number two, this is what you see the success of any treatment is 4 factors. I made it on my own. Nobody teaching me. But this is just based on observation. Okay? Number one, choose a good doctor that you can trust. Because the doctor will be in the same journey with you. Number two, you yourself, the patient, should be brave enough and face the problem. Okay? What they call, you have to bite the bullet, right? Number three, family, right? It is different patient's journey in the treatment of cancer when the family and their children supportive, very supportive, bringing together with you, pampering you and things like that, right? Family factors is very important. And of course, the last and the most important, pray. In Makati Medical Center, once we have a diagnosis of a cancer with adequate workups, let's say the metastatic and things like that, then I will propose for, they call it an MDT. The MDT, multidisciplinary team meeting, wherein doctors who are treating cancer patients, like the surgeon, surgical oncologist, and the medical oncologist, the radiation oncologist. Occasionally, we invite also pathologists and radiologists because we want to have a CT scan result or the MRI, whatever. No? Cancer Center of MakatiMed, the official, started 2011. And now we are on the 14th year. No? The MDT, that meeting, since it becomes the backbone of our work in the Cancer Center, average around 25 to 30 meetings per month. So I have the data, actually, is something like 3,800 something in the last 13 to 14 years. That is an achievement, because that's how we do it. And patient was so grateful because they are partner in decision making and also they know what to expect. Makati Medical Center is the hospital. I think we know that. Why? Number one is the most important is the hospital with the heart. Number two, well equipped. Number three, the doctors are, you might say, probably the trailblazers in their own specialty. So I'm saying they're pioneering. The initial generation of MakatiMed doctor, it's really the who's who of doctors in the Philippines. But the second and third generation, we maintain that kind of stature.